Good morning, folks. It's Diamond with the Oppenheimer Ranch Project and Magnetic Reversal News, bringing you the Friday, March 13th coronavirus pandemic update. What you need to know. Let's walk it through quickly. The coronavirus cases as of now, officially 139,000 with 5,120 deaths, and over half have recovered. And now that death toll, 5,123, there's lots of misinformation. People saying that children are now getting sick, which is not true. I'm sure they're getting sick, but they certainly aren't dying. Let's take a look at the facts of the 5,132 current deaths. We're going to talk about age, sex, existing conditions of the patients. Here's the current statistics for all 5,100 plus deaths. If you get infected with this disease and you're 80 years or older, you have a 1 in 5 chance of dying. The total death rate for all cases in 80 plus is 14.8%. The next bracket, 70 to 79 years, has an 8% death rate for all cases. 60 to 69, 3.6% death rate for all cases. And then below 60 drops off like a cliff. The next at-risk group would be 50 to 59 with a 1.3% death rate, and every other age bracket has less than a 0.5% death rate. It falls to 0.2% if you're under 40, and there have been no fatalities from 0 to 9 years old. Now, the sex ratio, male to female, seems to be double, almost twice as many male as females are dying. And this may have to do with the fact that in the majority of the original cases in China, most of the men are smokers. So there is pre-existing medical condition or comorbidity associations with this virus. In fact, if you do have cardiovascular disease, that will increase your risks of dying, diabetes, chronic respiratory disease like COPD, hypertension, and cancer. All comorbidity rates. And those are that's the data up till now on age, sex, and existing conditions. Let's look at the headlines. The U.S. currently has 1,832 confirmed cases with 41 deaths with a 2.2% death rate. Countries of note, 4,200 cases now in Spain, death rate of 2.1%. 2,889 cases confirmed in France with a death rate of 2.1%. And 3,117 cases in Germany with a 0.2% death rate. Iran's numbers at 12,364 with a 4.4% death rate. And South Korea just hovering in at 7,979 with less than 1% death rate. Cases have increased in Australia to 160. Canada's numbers are rising to 158. And there seems to be an outbreak in Scandinavia here. Norway at 878. Sweden at 730, and just 155 in Finland. Those are the current statistics. Coronavirus, the FDA takes steps to speed up the testing. This is just a fluff piece. Stocks rebound and schools close. Everything is closed. Almost all activities have been banned for a month or more, including travel to many regions. But the testing is definitely not increasing, and we're going to show you why. Here, this is a live update. U.S. moves to spread testing as fight against virus intensifies. The Trump administration announced steps towards speeding up testing. Wall Street rebounds after historic losses. The virus is causing widespread social, political, and economic disruption around the world. An Australian official has the virus. He met with Attorney General William Barr and Ivanka Trump last week. Also, Governor Trudeau's wife, or Trudeau, his wife is now officially infected with the disease up in Canada. Spain declares a state of emergency and orders the first mandatory lockdowns, and Germany is pledging $600 billion to help businesses. Now, if we look at the Dow, it did recover quite a bit this morning, but it has dropped back down and is only up 1.7%. That may fall down by 4 p.m. below that line, and there may be no recovery. And there will not be a recovery for a very long time financially. And this is a Yahoo headline from yesterday. CDC tested 77 people this week. And U.S. officials on Tuesday were faced with an onslaught of questions from members of Congress amid reports of South Korea's drive-through coronavirus testing locations. We now have a drive-through testing location in the U.S. in the last 24 hours. And this is not a problem we can test our way out of. There just has been not enough tests. There are probably hundreds of thousands of cases, yet under 10,000 confirmed in the U.S., which is the problem. Red revealed in his testimony that the total number of people tested for the coronavirus by the CDC was a mere 1,784. That means as of Wednesday morning, the CDC had tested only 77 people for the coronavirus since Sunday. Is that what's really happening? While my boyhood home locks down, schools are closed. This is worldwide. As the number of confirmed cases skyrockets, do you see this blip down here? That's just no testing on purpose. They're purposely not testing because they don't want this to spike in the public eye, which will definitely drive fear. And that's what they're trying to eliminate. The panic buying is already on. The fear is already there. They should be testing. And you should be washing with soap. Do you want to know why soap works and you don't need all these other fancy things? You just need to spend a little more time with soap. 20 seconds. Clean under your nails. At the molecular level, soap breaks things apart. And at the level of society, it helps hold everything together. So we need you all to keep calm, stay safe, wash your hands frequently. And the first part of a two-part series on the coronavirus agenda was just put up on Suspect Sky. Go check it out. We need you all now to be prepared, not scared. Think smart and keep calm. We love each and every one of you. This is an ongoing event and it's just getting started. Stay home, stay safe, and keep calm.